At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. A neurological exam is broken down into several sections, each designed to assess different aspects of the nervous system. It begins with a mental status examination, followed by detailed assessments of the cranial nerves, motor function, sensory function, coordination, reflexes, and gait. Mental status examination. The first step is evaluating the patient's mental status, which includes assessing their alertness, orientation, attention, memory, and language skills. This provides vital insights into the patient's cognitive function and level of consciousness. Cranial nerve examination. The next step involves a comprehensive assessment of all 12 cranial nerves. Each nerve is tested for specific functions such as smell, vision, eye movements, facial sensations, muscle strength, hearing, balance, and more. Motor function. This section focuses on assessing the strength and coordination of the patient's upper and lower extremities. It's crucial for detecting any muscle weakness or abnormalities in motor control. Sensory function. The sensory examination tests the patient's response to stimuli like light touch, pain, temperature, vibration, and proprioception. This helps in identifying any sensory deficits that might indicate neurological issues. Reflexes. Reflex testing is another critical part of the neurological exam. This includes checking deep tendon reflexes and plantar reflex, which can provide clues about the integrity of the nervous system. Gait and station. The final component is evaluating the patient's gait and balance. This involves observing how the patient walks and stands, which can reveal problems with coordination, balance, or strength. To ensure a thorough and organized neurological examination, our Neuro Exam Checklist Template is an invaluable tool for healthcare practitioners. Here's how to use it effectively. Gather patient information and conduct a mental status exam. Start by recording the patient's basic information, name, age, and contact details. Then assess and document the patient's mental status. Conduct the cranial nerve examination. Systematically assess each of the 12 cranial nerves. Perform the relevant tests for each nerve and note whether the function is intact or if there are any abnormalities. Evaluate motor and sensory function. Proceed to test the patient's motor strength and coordination, followed by the sensory examination. Test reflexes and gait. Complete the exam by testing deep tendon reflexes and the plantar reflex, and then assess the patient's gait and balance. Note any abnormalities in these areas. By following these steps, healthcare providers can ensure a comprehensive and accurate neurological assessment, crucial for diagnosing and managing neurological conditions. Here is a sample of our Neuro Exam Checklist Template to give you an idea of how it can be used in your practice. To explore more of our free templates, visit our templates library on the Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features, and signing up is free. Just click on the sign up link in the description. If you found this video helpful, don't forget to like and subscribe to our Carepatron channel for more content like this.